And the word in the clinic today is HIV. So tomorrow is World AIDS Day. And so that's a Saturday. I don't always post. So I wanted to use that today for the word in the clinic. I do talk to my patients and families about HIV and about the prevention element of HIV. I have adolescent patients who get STDs. I have had pediatric patients that I've cared for with HIV, believe it or not. So this is a very relevant topic for pediatrics and something that comes up often in practice, especially with sex and behaviors that can lead to getting the infection. So let's jump right in. I just wanted to give you a stat. According to the CDC, in 2016, youth age 13 to 24 made up about 21% of new HIV diagnoses in the United States. 20%, okay? From 13, preteens, teens, up to young adults, 24, 20.1% of new cases in the United States. That accounts for about almost 8,500 youth each year, okay, in 2016. So that's quite a few young people, young adults, teens that are contracting HIV in the United States. So we do need to be aware that this is a possibility. 80% of those diagnoses occurred in young people 20 to 24. So the hot pocket is our young adults. And I see patients to 21, so that's very relevant for me. So the bulk of this conversation today is all about prevention, okay? So my first message is that how can we prevent our young people from getting this? Equipping them with the knowledge they need now at 10, 11, 12, 13 and on to know what to do, what not to do to make sure they don't get HIV. Because that's where it starts. So the message is talk to your kids. Hey, Monica, talk to your kids. Just saying don't have sex, don't use drugs, don't do this is not enough. We need to have ongoing, repeated conversations with our children about all of these things: pregnancy, STDs, HIV, drugs, all of these things ongoing, and not in a preachy way, but just gauging what they know, educating them, mixing it up, making it fun, utilizing the things they're doing to gateway into those conversations all the time. So that also requires you to be knowledgeable as well, so you're not spreading myths and misinformation to your kids. When you give them the knowledge, I guarantee you they will have the power to make the right choice and the better choice, right? So they have all these pressures out with their friends that are enticing because they're curious young people. But when we give them the knowledge, then they can go, oh, me and my mom talked about that. Oh, this is not good. And they can teach their friends. They are empowered to make the right choice. So talking to them is your first and most important line of defense in preventing them from getting HIV. So let's start it. I have 5 points. Abstinence. Yes, we want our teens, our young people, to abstain from sex as long as possible. If we're Christian or different religious beliefs, we want to wait till they get married, right? But not everybody believes that. So as long as they possibly can, teach them to abstain from sex, right? Abstain from drugs, abstain from all of these things that put them at risk, because that's the only 100% way to prevent getting HIV from a sexual way, that route. So you get HIV/AIDS, it's in the body fluids, blood, semen, vaginal fluids, breast milk, okay? So any behavior that puts you in contact with infected blood, semen, vaginal fluid, or breast milk, those body fluids, you have a risk of getting that infection. So sex is one of them. So yes, talk to your children about abstaining from sex, why it's important, why they're not ready. It's just not about the physical feel. It's also about a mental, a spiritual, psychological aspects and why they may not be mature enough to be doing that. So empower them and talk to them about that. So number one, abstinence. That's your 100% defense that you won't get HIV if you're abstaining from sex, abstaining from drug use, IV drug use, and things of that nature. Number two, safe sexual practices. So there are a percentage of young people who are not going to abstain. So we have to face the reality of that. A lot of parents don't think their kids are having sex, and when I talk to them, they are. So let's be real. Even if they don't want to tell you, assume that they may be, and go further with the conversation, not just to say don't do it, okay? Talk to them about condoms. Tell them to use condoms, how to use condoms, what they look like. That's not giving them permission. That's saying, if you find yourself in this situation, I don't want you to do it. Say no. But you need to be equipped to use this properly. So condom use every single time. Before there's any contact orally, vaginally, or anally, condom use every single time. Knowing your status is very important, even when our young people. So when we have young people who are having sex, then we need to talk about HIV testing, okay? Know your status. People walking around with HIV look normal. They look great. They look, fine. They don't look sick. They may not even know they have it, okay? So you don't know what anybody has, and you have to look at everybody like that and be careful. You get tested. Make sure they get tested before you engage in any activity that you can transmit this disease, okay? Limit sexual partners. So some of our guys are trying to rack up trophies, right? Hi, Seema. And it's popular, as many partners, and I'm a man, but that's not good. The more partners you have, the more increased risk you have for getting STDs, including HIV. So condom use, limiting your partners, being in a monogamous relationship is the best situation outside of being abstinent. Also, limiting your exposure to drugs and alcohol, because we know that confuses, it lowers your inhibitions, it keeps you from making good decisions. You're more likely to do something risky if you're influenced by drugs and alcohol, right? And so not using the condom or having multiple partners when you're engaging in drug and alcohol use. So definitely want to teach our children not to have a clouded mind. So those are all within the realms of sex. The second way is IV drug use. Hey, Yvonne. So blood. IV drug users, needles with tattooing, anything that utilizes needles, that you get stuck with the needle or you're sharing needles, IV drug use, you can get it that way. So we definitely want to talk to, unfortunately, we have young people who are using drugs in that manner. We have young people who are getting tattoos on a regular basis. You need to be safe. You need to make sure they're opening a fresh new needle pack. You see it with your own eyes. They're not being reused, especially if we're doing it in someone's home. And if you are using drugs, IV drug user, make sure you're not sharing needles. Really think about that. Hey, Yvonne, I miss you too. I'll be in, you see? And then third, there's a small percentage of children with congenital HIV. So children who were born to parents who were HIV positive, mothers who are HIV positive. So the message here is that if you're pregnant, if you're expecting to get pregnant, please know your status. Please let your doctor know. Please allow them to test you. Because if you are positive, there's ways to treat yourself to keep your viral loads low so that it won't transmit to the baby. And also when the baby is born, there's ways to treat and test the baby, and they don't have to end up with HIV. We have great treatment and prevention for that now. So if you're pregnant, know your status and get the proper treatment. And also don't breastfeed if you are HIV positive. So those are some tips there. But there are some young people who get it from being born to an HIV mother and didn't get the proper treatment, and they have congenital HIV. The last point I have is for a special group of people, and unfortunately it is something that's pertinent to the young adult age range. There is a medication called PrEP. It's pre-exposure prophylaxis, and this medication is indicated for individuals who are in ongoing risky situations for getting HIV. That's kind of the best way to say that. So if you're unfortunately in the sex industry, or if you are regularly not using a condom and making some poor choices that puts you at risk. If you're a man who has sex with men, if you are in a discordant relationship where one person has HIV and you don't, Also, IV drug users, people who regularly use IV drugs and they haven't stopped and healed that process yet. Those individuals should consider seeing a doctor and discussing starting PrEP. That's a daily medication that has been shown to be very effective to prevent the transmission of HIV. So that is a newer medication.